The Home Health Plan of Care, or POC, is essential to ensure that patients receive safe, effective, and personalized care in their homes. Tina, can you tell us why it's so important?
Yes, Hannah, I can. It ensures continuity and coordination of care for all disciplines involved in the patient's care. It meets CMS legal and regulatory requirements. It individualizes patients' care. It establishes measurable goals, and it guides clinical decision making.
The Home Health Plan of Care is a foundational document that drives high quality, goal directed care while meeting regulatory, clinical, and ethical standards. Steph, can you describe to us some of the critical elements of the Home Health Plan of Care?
Sure, Hannah. The critical elements of a home health plan of care are those required to ensure the care is safe, effective, and meets regulatory standards, especially for Medicare certified home health agencies. These elements guide the interdisciplinary team and support compliance with CMS regulations. So here are the key elements that must be included. First off, patient demographics, such as the patient's name, date of birth, and address, their Medicare number or insurance information, and emergency contacts. Next, you want to include their diagnoses. Of course, the primary diagnosis is the reason for home health services. All of the secondary diagnoses are comorbidities that will impact care. Prognosis is the clinical expectation for recovery or stability, and a big one on the plan of care is medications. So all current medications should be documented on the plan of care, including any prescription medications, over-the-counter medications, and including supplements. Also remember, medications must include the route, the dosage, and the frequency. All PRN meds must have a reason. Insulin sliding scales should be very specific. Enteral meds must be on the medication profile. If the patient's on oxygen, or if they're receiving a tube feeding or IV infusion, be sure these are also noted on the medication profile. High-risk meds should be identified on the plan of care as well. High-risk meds include opioids, insulin, non-insulin injectables, antipsychotics, and blood thinners such as anticoagulants and antiplatelets. Tina, do you want to tell us about safety measures?
Yes, I can. Thank you, Steph. On the safety measures, you want to ensure that every patient chart includes standard and fall precautions. Some of the other measures that you want to include are infection control precautions, diabetic precautions, oxygen, anticoagulant, and antiplatelet precautions, bleeding, respiratory, and cardiac precautions, seizure, aspiration, and joint replacement precautions, and fracture and spinal precautions. Keep in mind that each agency may have their own additional precautions that they may want added to the plan of care. The next one is functional limitations. This includes mobility issues, cognitive impairments, sensory deficits, and the level of assistance required for activities of daily living, better known as ADLs. Some examples are limited mobility due to peripheral neuropathy. So in this one, you would add ambulation and pain. The next one is requires assistance with dressing due to COPD. So you're thinking about their level of dyspnea. And the last one is a patient is missing 4 toes on the left foot. So in this one, you're going to be thinking about the amputation and the ambulation. Some other functional impairments to consider are vision, hearing, speech, ambulation, endurance, fatigue, pain, especially if it's chronic pain, the dyspnea with the degree of exertion, whether it's moderate, minimal, or at rest, contractures, paralysis, amputation, and fractures. The next one is medical supplies and equipment. So on this one, you're going to consider the durable medical equipment, better known as DME, which includes things like your walker, wheelchair, shower chair, bedside commode, elevated toilet seat, oxygen equipment such as a nasal cannula, tubing, CPAP, or BiPAP. Special needs such as hospital beds or infusion pumps, and then medical supplies such as diabetic, Foley, suprapubic supplies, ostomy supplies, and wound vac or other wound care supplies.
You want to be sure and include allergies, so identify any patient allergies noted in the medical record. You also want to include the patient's nutritional requirements. So include any MD ordered diet, such as a diabetic diet, heart healthy, or low sodium diet, a fluid restriction related to CHF, increased protein intake for wound healing, a PEG tube or feeding assistance needs, and be sure the diet is physician ordered. Don't add diet needs based on the patient's diagnoses. Another important element is to list the skilled services that will be provided with the frequency and duration of each service by discipline. So if the nurse and the therapists and the home health aides are going to see this patient, we just need to know how many visits each discipline will be making per week and how many weeks they plan to see the patient. And that's essentially the order to go see the patient for each discipline. The interventions and goals are another aspect that is very important, maybe the most important aspect of the plan of care. The interventions should include the focus of care. So this is the reason that the patient is being seen by the home health care agency. Then you want to include any comorbidities that are very important and going to affect the patient's care, such as cardiopulmonary diagnoses like CHF, COPD, and another big one such as diabetes. You'd want to make sure there was a comorbidity statement for that. If there's patients going to receive any treatment orders, you'd want to ensure that treatment orders are present and include all aspects related to the treatment. Treatment orders might include wound care, urinary catheter care, ostomy teaching, tube feeding, administration and teaching, PICC line and IV care, dressing changes, measurements and flushes, any orders for labs including blood glucose and INRs. And be sure to include the process measures as appropriate, including depression, pressure ulcer prevention, pain, and falls. And remember, all interventions must have a patient-centered goal with a measurable outcome. Be sure and use an actual date within the certification period and do not use EOE or end of episode. Tina, can you finish telling us what the critical elements of the plan of care are?
I sure can, Steph. Thank you. Patient and caregiver education. Topics to be covered such as disease management and medication safety. Teaching strategies to be used and documentation of understanding should be noted in the medical record. And lastly is the physician's signature and date. The plan of care must be reviewed, signed, and dated by the certifying physician at every start of care and updated every 60 days at recertification.
Including all of these elements ensures the plan of care meets CMS regulations and supports high-quality coordinated patient care.